Well, we've been handling aortic dissection cases for more than 25 years here at our law firm, and that involves usually the failure to diagnose an aortic dissection and treat it. And what that means is that a person will have a pending dissection of their aorta, and the doctors fail to identify it and report it, and it is left untreated. And unfortunately, a dissection is a fatal disease if it's not treated immediately. The most common type of aortic dissection medical malpractice case is where a patient comes into the hospital, usually the emergency room, and has chest pain or back pain and possibly some other symptoms like shortness of breath, and a radiology exam like a CT scan or a chest x-ray is performed, and that x-ray or CT scan actually identifies an aortic dissection. But for certain reasons, the person who reads that film, the chest x-ray or CT scan, fails to identify that and then fails to report it to the emergency room doctor, and it goes left untreated. And aortic dissection is a fatal disease. If it's not treated immediately, you will die from it. So that is probably the most common aortic dissection case that we handle. When you hire us to develop your aortic dissection case, it means that a member of your family has died from the failure to identify and treat your loved one's aortic dissection. We know how to develop these cases. That is, we know how to ask the right questions of the hospital, get the correct medical records, and find out whether a mistake was made that caused the death of your loved one.